Hey Keith, it's Dr. Valinga, Peter, and the rest of the surgical team. We examined your knee while you were asleep, and it was nice and stable. I'm not concerned about any major ligament injuries to your knee. What you're looking at here is a probe coming in through this blue cannula. It's 1 millimeter wide at the tip, 3 millimeters long. That gives you an idea of the magnification. We are looking up towards the top, up above your kneecap. I'm going to push down from the outside, get this probe out of the way. So up there, I'm pushing down from it. That's the undersurface of your quad tendon. That looks normal. As we back up here, next thing we see right there is your kneecap. This is the undersurface of it right there. Looks good. No sign of arthritis, so move that out of the way, sweep that out. No arthritis there, no arthritis on the outside. No, so we'll do that later. So looking down the inside part of your knee, down the medial gutter. So you have your thigh bone up above, your shin bone down below here. And what you're looking at here is here's your meniscus. And this is not normal looking. It's missing. There's a split tear right here. Right there. And it should be bigger than that. So it's like we're almost missing a piece of meniscus there. We'll come back, look at the inside part of your knee a bit more. We're going to sweep across to the outside first, though. A little bit of thickened tissue here. Slide down here. There's the outside part of your knee called the lateral gutter. Look down between the bones. We're going to work our way to the very back outer corner here. That's your popliteus tendon up there, coming up and inserting on your thigh bone there. Here's what a meniscus should look like. This is your outer meniscus right there. So it's this fluffy structure that makes up the floor right here. That's meniscus. This is that shock absorber in the knee. Goes between the two bones, acts like a gasket. See how healthy that looks? It should be soft. Should come to a nice tapered point here. So that's beautiful looking. As we change the position of your leg here, we're looking at the center of the knee. Here's your ACL right here. But then you have, I'll clean some of that fluid out, clear up our picture. But then you have this. This is actually your inner meniscus, your medial meniscus that is flipped completely into the center of the joint here. So we're going to try to push it over. Part of our ability to repair this thing is to slide it back into place over there. Like that. We'll see if we can get it back there. So we'll keep playing with that, try to get that back in there. So there's your meniscus flipped back down into place. Again, it just kind of wants to keep flipping out there. Our ability to fix this thing is going to see if we can get that to stay out in place and stitch it back together, which I think we should try. I'm going to wiggle through to the back part of your knee. This is down through the center of your knee, looking in the back. No loose bodies there. No definite ramp lesion there. Here's the back part of your meniscus, and again, this is where it's torn. There's a PCL to our left. That looks fine. But here's that big flipped up piece of meniscus. That's what we're here to fix. So before we get to all that, let's go over here. Change the position of the leg here. Yep, we'll look up in the outside part of your knee. Good. So here's your lateral meniscus. Again, this is what your meniscus should look like. Stable anchor to the bone there. Upper surface, lower surface look perfect. Behind this, we see your popliteus tendon back there. This is what a healthy meniscus looks like. No arthritis on either bone there. So that looks good. So let's get to work now on this meniscus. So we'll see if we can, if it's intact, and it seems to be, we got a chance of saving this thing. So, flip that down into place there. a bit shredded there. We're going to have to nip that piece out. But when we hold it back like that, that's what we gotta try to fix. It's such a substantial piece of your meniscus. I do think we should try to fix this. I think for the long-term health of your knee, if we can get this to heal, this part's just gonna have to come out. But we'll try to get the bulk of it back down into place. So as you can see, the split starts right back here. Clear that up a little bit. Good. So the meniscus tear starts right back in there and extends all the way around to the front. So we're going to have to tack this in all the way around. So we got some work to do. Let's get rolling with some. First we got to kind of freshen up the area back there. Get it to bleed, yeah. So I'm going to actually flip this out of my way. Get back behind it. We got to kind of clean up all this tissue. Roughen this up so it can receive the meniscus. And try to heal it back together. So let's see a shaver. Okay, so we're just taking this in here. We're going to try to rough up all this tissue here. Try to get this to heal in. And I'll be honest with you, I think, the good thing is you're young. So I think we have a chance of this thing healing. I think it's worth trying just for the long-term sake. Because without any good meniscus in here, the likelihood is low. Of your knee doing good long term is low, because as you can see here, you just don't really have any meniscus. I mean, it's really almost the whole meniscus that tore. So have a chance of having any protective function of this thing. I think it's definitely worth trying to get it to heal in by putting it back in place there. So we've kind of roughed that up there. All the way around back there. Let's see the biter. Just going to nip out this little bit of undersurface there. Anything that doesn't seem too viable. Okay. All right. So this is our little repair device that we're coming in here. We'll use this to pass stitches through there. Okay, so we use this one. We're going to push through here. And we push that in. And then as we deposit that, and then we'll come back out here, and we'll move over. And we'll put that other one in. we'll start to pull that out there. There's our second stitch. So then as we tighten one of these sutures, the loop, so as we tighten that loop, pause. And then as I pull this other one, it's going to cinch this down. Good. That'll suck in there. You can see how that tethers that down and has now repaired that to the back in there. So like how that looks. Take our cutter. So now we'll come in here and we'll cut the excess suture off. Good, and there we've got our first stitch in there. We'll come in with our sled. Do another one. So we'll have to nip that little torn piece out there, but we're going to try to preserve all the rest here. So we'll go in there. We'll come out there. Good. We'll push in here. Like that. We got to capture the bulk of this. So there we passed our second stitch. We'll suck that down there. Good. And then we'll cut this tail. Pulse. So there's those two in the back. Here's our split there. Now this meniscus is staying in place, so we're gonna keep working our way around, probably do 2 or 3 more stitches at least. Here's our next stitch here. Hold the camera, please. That. Tighten the one. I'll suck that down. Good. We'll tighten this other one. Good. Pause. Okay, so now you can see that thing is tacked back down in place. Nice and solid. Repair, good compression between the two. So we're going to pass one more stitch, this one right here. You can see here's a frontal extent of the tear right there. So we're going to have to pass one more stitch. Through that part. We're going to have to do this one from inside out. Or sorry, from the outside in. So I'll show you how we do that. So for this one, we're going to come in here. You can see our tool coming in. So that's from the outside in. So then we slide this stitch in there. Come in here. This is broken. Let's see a different grasper, any type of grasper. Then we'll pull that needle out. We pop back through there. Come out with that probe. Okay, so we'll come in now with this little grasping tool. We'll go through there. Pull that out. And Peter, just pull the chia out. Hold this. Just grab it, pinch like that. Yep, now we'll pull the whole thing out. Good. That passes that stitch there for us. Okay. So I'll repeat that process again. Hold that there. Can actually come out with the probe. Okay. Pull that needle out. Hold that. Okay, so there's our other one coming in there. We'll slide in our retrieving device. And we'll come through here. Grab that stitch. And pull back. Good. There's our second one, and you can see as we hold that, that holds that down. So now we've got that meniscus repaired. So we got to tie these other two stitches. We got to make incision on the outside of your skin to tie them down. So we'll do that, and we'll show you. Take a look back in the knee when we're all done. Okay, so now we're tying from the outside in here. You can tension this carefully. This is a delicate suture. And as we tighten that down, we'll back this up with a few stitches. By just backing it up with a few other little stitches here to make sure it's tight. Good. Okay. There's one stitch there. Scissors. Good. So that stitch is holding tightly. Now we'll do the same thing with this other stitch. We'll show you that as we tighten that down. So again, just locking that down with our knots. Back that up a few times. Good. Oh, looks like that one may have pulled out, actually. I'll have to pass that one more time. Yeah, we'll pass that one more time and get one more stitch in there. You can see that's nice, tight there. We'll go right there one more time. Okay, so same thing. We'll hold on to that. Take that. Good. Needle. Pulse. So every once in a while we get the not so pleasure of repeating some steps here. Good. So now I've got another good stitch there. Get a little more gentle tying this one. Pause. Alright, so there's our next stitch. Good. That's nice and snug. Great. All right, so let's take a look at our final product here. Probe. So there we got it tightly repaired in the front, repaired in the middle, without stressing it too much. We've got it. You can see it's repaired all the way around the back. Tucked down nicely there. Okay, well, I think we've given you the best chance we can to heal this meniscus in and give us a good meniscus going forward. So the last thing we're going to do, I talked to you about this, we're actually going to make some bone marrow vents in the bone right here to get some of your stem cells to come out of your bone and help finish this repair. So we'll do that right up in this area right there. Okay, so here we put this in the bone there. I'm going to do that a few times here. Just push that into the bone. Come tap that in over here. Go ahead, yep. Keep going. Good. So I made 3 holes in the bone. When we take this scope off, so the last thing you're going to see us do here what we're going to do here is we'll first go look up, just up in the top of the knee, make sure we don't have any loose pieces up there. Oh, I don't see anything crazy. Let me see the shaver. Put this up in here. That's all right, that's normal. All right, make sure there's just no loose pieces floating back around in there. And we'll come back down here and gently swing back down. So what you notice here is as we turn off the pump pressure, probably going to see some good bleeding start to come out of those holes that we made in the bone here. You'll see it starting to, a little bit of oozing out there. So once that pressure in the knee comes down, those will start to ooze some bone marrow out of there. Not quite as gratifying visually as I wanted it to be. Sometimes you can see the marrow just kind of streaming out of there. So those, you can see those bubbles coming out there. Those little yellow bubbles, that's your bone marrow, and then the blood's going to follow that right there. So that's what we want to see. Yeah, so that's going to really start pumping out. Stem cells will come out into the knee. Hopefully do the real healing here. So that finishes up the case for us. Turn this on real quick here. I'm just going to put some numbing medication in your knee here. So we appreciate your trust, Keith. We wish you the very best in your recovery. I think we've given it the best shot that we have to have that meniscus repair. We're going to be very careful on how much we bend your knee to give it time to heal. Definitely not going to be putting any weight on it. There's a needle coming in for us to put the numbing medication in there. We appreciate your trust. Wish you the best. Thanks.